think is amazing about St David's Hospice Care is that it's forward thinking. It's never happy to rest on its laurels because it gets good feedback that's dynamic and always willing to listen and learn and change. And that's one of the best things I think about working for an organisation like that.
The most important thing about St David's is actually their aim is to keep the patient and family a priority.
Coming to work here is just so different and so rewarding. It's these people that you've helped, and as I say, that legacy stays with them.
I see the benefits that coming into day hospice offers a patient, the change in them. When I see them at home, they're frightened and anxious, isolated, they might not see anybody all week, and then they come into day hospice and all that just disappears. They just find a little bit of relief.
As well as being medically and nursing led, I can also refer on for social support for our day hospices and also complementary therapies, and I think it's very important that you're not always just giving somebody a tablet.
Apart from the physiological and emotional side effects, just being touched positively can have a massive impact on patients, and patients often report that to us, that it was nice to have someone hold them in a structured way. We receive referrals from nurses for different reasons. Some reasons are pain. Some people want to come and see us because they're feeling nauseous because of their chemotherapy or some of the medication they might be taking. I think the most common referrals would be for anxiety and stress, and that's what I think we can really help with.
Working with the benefit system, I can bring them in enough money for them to be able to, to carry on without having to worry about the money side of it, to be able to concentrate on their treatment and their will to get well.
People who've got life-threatening illnesses need a lot of psychological, emotional, mental support from us. And so one of my roles, I'd say, is to take a sort of counselling role and to try and understand what it must be like for that person to be in that place, to be in that situation, and to listen sort of actively, intently. Every person that I see is different, and we cover a wide geographical range and a wide social range.
My part in it is a little bit of fundraising. We've organised the City of Newport Half Marathon, which was absolutely brilliant. And I also oversee the lottery and database office. So the monies coming in are all allocated to the donors, the thank you letters get sent out, and the lottery is a large part, is a vital source of funding for the work of St David's. The money they bring in over the course of a year, the lottery membership paid for something like 33,000 hours of nursing care.
A lot of the people, volunteers in the shops, volunteer because St David's have helped them.
I work twice a week, and those are my special days when I know when I get up in the morning I'm going to meet all these lovely people through the day.
It's the money. You think, you're raising the money, and that's what you can do to help.
Mum never talked about dying. She never wanted to bring up the conversation. No. She didn't want to know how long she had to live, and she never asked us to not ask. But anytime anything was ever talked about, she said, I don't want to talk about it.
I think, yeah, it is. It's that feeling of when you're most vulnerable and you're so scared and you're just the worst time in your life, and you think, and you know that you can ring them, or you know that your mum could speak to them, and you just felt that they were there for you.
You felt the general love from them as well, didn't you?
It felt like they really loved mum.
Yeah, and it felt, and for us as a family, it felt like it was just us. When I went into Mum's room and realised that she wasn't responsive, I rang Helen, and she was at the house within 10 minutes, and she just held my hand and said, everything's going to be fine. Yeah. And then she asked if she could have a chat with Mum on her own, and so Mum didn't feel that she couldn't say or do anything in front of me to hurt my feelings. They chatted on their own. Yeah, and then Helen called me back in and said, come and sit on the bed now, we'll have a little chat. It was just it was really sweet, It was lovely.
The moment I arrived at St David's, you just recognised that this is what I trained to do. This is really what nursing is all about.
I actually love to tell people that I work for St David's. I really do.
It's just a wonderful place to work, and it's a wonderful place to be every day.
Wonderful people. My partner, he died with cancer. That's how I found out about St David's, and I can't do enough for them, and they do a lot for me.